This is Ryan Hoyme, aka Massage Nerd, and today I have Dr. Kerry D'Ambrogio. Did I get it right then?
You got it.
Okay,
close.
perfect. So tell me a little bit about your business and how you got started in the field then.
Okay.
Yeah.
My background is I'm a physical therapist. Okay. I'm an osteopath. I'm a doctor of oriental medicine. And basically I got into this.
Wow, that's a lot.
I got into this because I was playing football in college. I injured my right knee, and I got exposed to physical therapy. They would submerge me into ice cold whirlpool tanks, use ultrasound, stretching, things like that.
Yep.
But what I found is that they never quite got to the core of the problem. They just kept treating the symptoms. And it wasn't until I got into physical therapy school that I met one of my first mentors, Doug Freer. He taught me about craniosacral therapy, myofascial release, muscle energy. And he said that these techniques kind of get to the core of the problem. So I quickly started to study all these things for selfish reasons. I wanted to get my body fixed up, my knee fixed up. And once that got fixed up, I realized that, you know what, there's a market out there. People need to know how to do all these different techniques because a lot of people out there are just mainly, working on the painful area instead of looking at the body as a totality.
Yeah. So how long have you been doing this then?
Oh, geez, 25 years?
Okay.
I was fortunate. I got to study with John Upledger. I learned my cranial from him.
Okay.
Jean-Pierre Burrell. I learned my visceral manipulation from him. Dr. Larry Jones taught me strain counter strain. So because I go back a ways, I had all the originators of the techniques. So I was able to study with them and see how they perfected their art.
That's awesome. Yeah. So what's the main style you perform then?
Well, right now what we've done is I've kind of made a complete circle. I used to study with all those gentlemen I told you about. And now I've kind of come back to the Upledger Institute. We have a goal in mind. What we want to do is integrate all these different institutes. We have the Chickley Institute that does lymphatic drainage.
Yep.
We have the Upledger Institute that does cranial work. We have the Burrell that does the visceral manipulation. And what we want to do is we're going to start off with the Dambrogio Institute. We want to kind of fill in the gaps. We want to teach myofascial release throughout the whole body. We want to teach muscle energy techniques, which look at joint dysfunction. We want to teach positional release therapy that treats muscle spasm problems. And the key thing I'm excited about is a technique or an approach called total body balancing. This is from the work of a gentleman by the name of John Wernham, an osteopath from England. This guy was 99 years old, and he was still treating 8 patients a day. He passed away about 2 years ago, but he taught me to look at the whole body as a totality. And a lot of times people just work locally on an individual joint. He says that you need to integrate things. So if you worked on a liver, let's say, he would say we need to integrate that in with the rest of the body. If you worked on the cranium, integrate that with the rest of the body. So in total body balancing, we teach you a full body evaluation and how to, we teach you a template, how to go through the whole body in about 20 minutes and how you can integrate all these other wonderful techniques.
Oh, that's awesome. So how long does it take to learn the training, and is there different classes you have?
Yeah, they're in the Dambrogio Institute. Okay. They're basically 3-day classes. Okay. And we have a positional release therapy for the upper and lower quadrant that teaches you how to evaluate and treat protective muscle spasm. So lower quadrant would be your lumbar spine, your pelvis, your hip, knee, ankle, foot. Yep. Upper would be everything above, the ribs, upper extremity, cervical, thoracic. We divide it the same way in muscle energy, which teaches you to evaluate and treat joint stiffness, joint hypomobility. So the same, lower quadrant would do the lumbars, the pelvis, sacrum, etc., lower extremities. Upper would do everything above the body. Same setup for myofascial release. We do upper lower body for that.
Okay.
And then total body balancing teaches you full body treatment and full body evaluation. They're all 3-day classes. But we also offer the classes to clinics and hospitals, 2-day classes, and we supplement it with video material of me lecturing, so they're able not to take too much time away from work.
Okay. And then what is your main clientele? Is it mostly massage therapists taking these classes, physical therapists, or chiropractors?
Because of my background as an acupuncturist, physical therapist, osteopath, we get an eclectic group of people. A lot of massage, a lot of physical therapists. I get some athletic trainers involved. Occupational therapists, sometimes speech therapists if I'm working on this area up through there. We get some acupuncturists and things like that. So it's open to a wide assortment of different people.
Okay. And then where do you see the future of this going then?
Well, what I'm working on myself is trying to do less but get more from it, like the 80-20 principle.
Yeah.
Is that I find that we tend to overtreat, we tend to do too much. And I'm always an advocate, if I only have 20 minutes to work with someone, I'll spend 15 minutes evaluating and 5 minutes treating. I want to find out if we go to that right area and we can unlock whatever that problem is, whether it's joint, muscle, fascia, and also we haven't mentioned the emotions, the consciousness aspect of it as well, belief system. Because the body, we teach in my class, is a dynamic unit of function. It's all integrated, mind, body, and spirit. So I think the future is that integration of mind, body, and spirit, and also the energy work as well. Some of the techniques we're going to do in the future are kind of off the body. And that's strange coming from me because I've done 25 years of on the body.
Yeah.
These techniques we're now doing is off the body, which I find can in some cases be more powerful.
Yeah. And can this be incorporated in regular massage treatments too and stuff too?
Yeah, I get a lot of massage therapists, they ask me, well, how can I do this, especially if they work in a spa?
Yeah.
But I would say when a patient comes in, if you're in a private area, have them come in, in shorts and a t-shirt or whatever, or in a gown, and then do your interview, do some evaluations to see, what's their goal? What are they trying to get at? Is it just wellness? Do they have a painful area? What's happening? I would evaluate those areas, and then you can go in there and do a little bit of manual therapy, loosen some things up, and then you can say, get undressed and let's do the massage. And that the massage would be the integration, trying to improve blood flow to within from all the different structures.
And then you teach classes all over the place then?
I teach it internationally. I do a lot in Japan, China, Australia, South Africa, throughout Europe, Canada, USA, Israel, all over the place.
And is there a certain protocol to it? I know like the Up Ledger, they got the 10-step protocol and stuff, or
protocols are good at the beginning to teach someone not to miss anything
to get the basics
and to practice,
down first.
get the basics down. And we do give you a little bit of to try this, and that. But what our goal is critical thinking. We want to have a smarter therapist. We want you to understand your anatomy, your physiology, and teach you some evaluation skills that you're not just being a technician applying a technique, but having a reason. I'll give you an example. Let's say you came to me with a headache or shoulder pain. Most therapists out there would go directly to your head or your shoulder and do some kind of technique there. What we want to teach our practitioners is evaluate, find out where this is coming from, right? That's the first thing. Once you find out where it's coming from, let's say it is coming from your shoulder, the second question you want to ask is, what do I do when I get there? Do I work on the fascia? And the fascia could be around a muscle, a bone, a joint, or organ, or cranial system. Do I work on the joint? Do I work on the muscle? Do I work on the fluids around there, like the chickly work? Or do I need to do an exercise there? Do I need a modality there? Is it emotional? So once you determine what it is from your evaluation, then you can pick the right treatment, because all therapies work, and then be able to do that with your patient.
And is there any certain contraindications, major ones at all?
There's always, if someone is new to it, there's always contraindications because if they're not good at handling. But all the techniques I teach are safe. Very gentle touch. Contraindications might be if someone has cancer in an area. Be cautious about working that area. You don't want to metastasize the area. If somebody has metal in their body, be careful how you're working with them. If they've had an accumulation of injuries, car accidents, things like that, or they have an acute injury, I think if you're proficient and you can handle people properly, very few contraindications. Because I work with osteoporosis, people with Harrington rods in their backs. It doesn't matter what it is, as long as you're gentle, you can work with them.
What things have you had the most success with, would you say?
With our techniques? I work with pediatrics. I love working with the kids. So we've worked a lot. Erb's palsy. I had a young kid come in. He had a brachial plexus injury. We worked with him about 8 times, and we were able to release the sternocleidomastoid. We did some cranial work, opened up the thoracic inlet. It was his left arm that was affected. He couldn't lift it up at all. By the end of those treatments, we were able to have full range of motion. So kids are fun because they're growing and they have lots of energy. The most difficult patient would be your elderly patient because they've had a whole life of dysfunctions and emotional problems, things like that. But they can still be helped as well. It's like removing away the layers of an onion. Someone who's older has more things we have to work with.
So you watch Shrek then, right?
Exactly. And athletes are a lot of fun to work with because they have a lot of vitality inside them. They have a good immune system. They have a good physiology because of all the training they do. So when you give them a treatment, they just will flourish with it. They respond very quickly. Your couch potatoes will be your worst people to work with.
So it's a 3-day seminar then, right?
They're all 3-day, but we can modify them into 2 days or 2.5. We can, if someone approaches us and they want us to do something, even we can do it over 5 days. So we do all sorts of little, like I can do a course on the pelvis or the rib cage or thoracic, so we can modify it anyway.
So people are interested, they can contact you and even maybe host it at their place or something like that too?
Exactly. They can go to www.dambrogioinstitute.com.
Okay.
Or they can contact the Upledger Institute. We all work together as a group.
That's so nice you guys are.
Yeah. Our goal is to kind of create a like an osteopathic training school with all the different techniques, so that anybody, if they don't want to go back to school full time, they can go back in part time. I can take this course, that course, and our goal is by the end of all this, they're proficient at looking at the cranial system, the visceral system, look at the lymphatic system, as well as the fascial system, the muscle system, the joint system, and putting it all together.
Well, thank you very much, Doctor.
Thank you.
Thank you.
All right.
Thanks, everyone.